What actually happens when a human brain dies? Not unconsciousness, not a coma, not being asleep. Real brain death. The moment when the brain permanently stops functioning. No thoughts, no awareness, no recovery. And yet, the heart may still be beating. The body may still feel warm. Machines may keep the lungs moving, which creates one of the most disturbing questions in modern medicine. If the body is still alive, is the person truly gone? Today, we're diving deep into the terrifying reality of brain death. What actually happens inside the human body, how doctors determine it, why it's different from a coma, and the frightening moment when consciousness permanently disappears. Before we begin, if you enjoy fascinating medical, science, and psychology videos, make sure to subscribe and turn on notifications because we upload new videos every week. Now, let's get into it. Most people think death happens instantly. The heart stops, everything ends. But reality is far more complicated. Modern medicine has changed the definition of death itself. In the past, doctors mainly looked for one thing: heartbeat. If the heart stopped permanently, the person was declared dead. But today, machines can artificially keep the heart and lungs functioning even after catastrophic brain injury. And that forced science to ask a terrifying question: what truly defines a living human being? The answer modern medicine arrived at was this: the brain. More specifically, the irreversible loss of all brain function. This condition is called brain death. And unlike many other medical conditions, brain death is permanent. There is no recovery, no waking up, no returning. And that's what makes it different from a coma. Many people confuse coma and brain death, but medically they are completely different conditions. A person in a coma is still alive neurologically. The brain still shows activity. Some reflexes remain intact. The body may still attempt to regulate itself. And in some cases, coma patients recover consciousness. But brain death is different. In brain death, the brain permanently stops functioning entirely. No consciousness, no brainstem reflexes, no ability to breathe independently. The brainstem is especially important because it controls the body's most basic survival functions: breathing, heart regulation, swallowing, pupil reactions, conscious awareness. When the brainstem permanently stops working, our survival without machines becomes impossible. And honestly, this is where the topic becomes deeply disturbing, because someone who is brain dead may still appear physically alive. Their chest may rise and fall with a ventilator. Their skin may remain warm. Their heart may continue beating for some time because the heart has its own electrical system. To families, the person may still look alive. But medically and legally, the person is gone. And that reality can be emotionally devastating. Now let's talk about what actually causes brain death. The most common causes include massive traumatic brain injuries, severe strokes, cardiac arrest causing oxygen deprivation, brain hemorrhages, severe infections or swelling inside the brain. In many cases, the brain suffers catastrophic damage after oxygen supply stops. And the brain is incredibly sensitive to oxygen loss. Neurons begin dying within minutes. Unlike some tissues in the body, brain cells have extremely limited ability to regenerate. Once widespread brain destruction occurs, recovery may become impossible. Now here's something frightening. Sometimes the process happens gradually. As swelling increases inside the skull, pressure builds around the brain. But the skull cannot expand. Eventually, the pressure becomes so severe that blood can no longer properly reach brain tissue. Parts of the brain begin shutting down. Then larger areas stop functioning. And in severe cases, the brainstem itself becomes compressed. Once that happens, brain death may occur. Doctors perform extremely strict testing before declaring brain death, because the diagnosis carries enormous ethical and legal consequences. First, doctors confirm the cause of the injury is irreversible. Then they test brainstem reflexes. They shine light into the eyes. Normally, pupils react immediately. But in brain death, there is no response. Doctors may touch the eyes to check reflex blinking. Again, no response. They test pain reactions, cough reflexes, gag reflexes, and one of the most important tests involves breathing. This is called the apnea test. Doctors temporarily reduce ventilator support while carefully monitoring the patient. Normally, rising carbon dioxide levels force the brainstem to trigger breathing. It's one of the strongest survival reflexes humans possess. But in brain death, no breathing effort occurs. The brain no longer responds. And if all criteria are met, doctors may officially declare brain death. Now here's where the subject becomes even more unsettling. In rare cases, brain-dead bodies can continue functioning for surprising amounts of time with intensive medical support. The heart may continue beating. Digestion may still occur temporarily. Hormones may still circulate. Some spinal reflexes may even cause body movements. And these movements can terrify families who witness them. A brain-dead patient may suddenly move an arm. A finger may twitch. The back may arch slightly. But these movements do not come from consciousness. They are spinal reflexes generated outside the brain. Still, for loved ones, seeing movement in someone declared dead can feel horrifying and confusing. And honestly, it reveals how strange the human body truly is. Now, let's talk about consciousness itself. One reason brain death feels so disturbing is because science still doesn't fully understand consciousness. What exactly creates awareness? How does the brain generate thoughts, emotions, identity, and memory? And what happens when those systems permanently stop? No one truly knows. Brain death represents the irreversible end of the biological processes believed to create consciousness. The person's experiences, memories, personality, and awareness disappear permanently. And that idea can feel deeply unsettling, because it forces humans to confront one of the greatest mysteries of existence itself. Now here's another important point. Movies and television often create dangerous misunderstandings about brain death. Characters suddenly wake up after being declared brain dead. In reality, true medically confirmed brain death is irreversible. There are no documented recoveries after proper diagnosis using accepted medical standards, and that distinction is critically important. Because false information creates confusion and unrealistic expectations for families facing devastating situations. Now imagine being a doctor responsible for making that diagnosis. The emotional pressure is enormous. Doctors must be absolutely certain. That's why multiple specialists are often involved. Testing procedures are strict and carefully repeated, because declaring brain death means recognizing the permanent end of a human life. Now here's something many people don't realize. Brain death also plays a major role in organ transplantation, because organs require blood circulation to remain viable. Machines can temporarily maintain circulation in a brain-dead body, allowing organs to remain healthy for transplantation. And this has saved countless lives around the world. But it also creates difficult emotional situations for families. A loved one may still appear physically alive while already being medically dead, and accepting that reality can be incredibly painful. Now let's ask perhaps the biggest question of all. What does brain death teach us about being human? In many ways, it reveals how dependent identity is on the brain itself. Everything you consider you exists inside this organ. Your memories, your emotions, your fears, your dreams, your personality. And when the brain permanently stops functioning, modern medicine considers the person gone, even if machines temporarily keep parts of the body functioning. And honestly, that may be one of the most unsettling ideas in all of science, because it reminds us that consciousness itself is incredibly fragile. A tiny organ weighing only around 3 pounds creates everything humans experience as reality, and when it permanently shuts down, the person disappears forever. If you enjoyed this video, subscribe to the channel and turn on notifications for more fascinating medical and science mysteries. And let us know in the comments. Do you think science will ever fully understand human consciousness? Thanks for watching, and we'll see you in the next video.